We're back. Let's head straight to contraindications. So we've talked about contraindications a little bit in the theory leading up till now. So contraindication is anything that may restrict or prevent a treatment from going ahead. So for example, a contraindication could be a positive reaction to a patch test. It could be a client that has had a sensitivity in the past. I mean, generally, if a client has had an allergic reaction to eyelash extensions, it's most likely going to be an allergy from an ingredient in the adhesive that we use. And when our body is exposed to a certain allergen or a certain product within the adhesive and we have an allergic reaction, every time that our body is then exposed to that product, we reject it even more. So generally, if a client has had an allergic reaction previously, they cannot have eyelash extensions again. I mean, you can absolutely give them a patch test, and if they are going to react, they will react from a patch test, but generally it is going to be a no-go. So just a few little bits of information here in terms of contraindications. So you've got restrictive and preventative. So restrictive means that they may not be able to have the treatment. You'll discuss that in the consultation. Preventative is absolutely not, for one reason or another. So I'm just going to go through a couple of these with you, and the rest obviously you can read through in your own time and do a little bit of research, because there is a lot and there just isn't enough hours in a day for me to go through every single thing, but I will cover the most common contraindications that do tend to come up. So sensitive skin, obviously you would patch test. They can still have the treatment if they don't have a reaction to a patch test. Eczema, psoriasis, dermatitis. I mean, this is kind of common sense. If they've got a little bit of eczema on their neck, then, you're good to go ahead with the eyelash extensions. Cuts, bruises, abrasions. If there's nothing around the eye area and if there's nothing that's going to irritate the eyes, so your pads that you put on the eyes, then you are okay to go ahead. Alopecia. I mean, generally it depends where. If they have alopecia and they're losing a bit of their hair, fine. If it doesn't affect their eyebrows or their eyelashes, then you can potentially go ahead and lash, but I would get confirmation from a medical professional or whoever they're being treated by that they can have them. If they've got the start of alopecia and we don't know exactly what it is and we're putting eyelash extensions on, it could potentially cause those eyelashes to come out prematurely. So that's just a cover of the couple of the restrictive contraindications. It does talk about contact lenses in there as well. I would recommend, if a client does wear contact lenses, to asking them to take them out and just bringing their glasses. Reason being is the adhesive, and we're going to cover this a little bit later on, but the adhesive we use has got cyanacrylate in it, which is the main bonding ingredient, and cyanacrylate loves moisture. So cyanacrylate can dry the eyes out when the eyelash extensions are being done, which can also dry the contact lenses out slightly. So that would be the reason we would want clients to take out their contact lenses. So preventative, a couple of examples for you. Infections. If a client has an infection, you recommend that they pop to the chemist, pop to their GP, get it sorted and get them back in. We do not want to be spreading any infection. Contagious diseases. So we've got in there conjunctivitis. We have got impetigo, which is a highly infectious skin disease. One thing to note with conjunctivitis is there's two types. So there is bacterial, which can be caused from poor hygiene with eyelash extensions, but there is also allergy conjunctivitis. So I am super sensitive and I do get a type of allergy conjunctivitis. So what happens is, because I don't have eyelash extensions very often, I've actually got little stick-on ones at the moment, but when I do have a full set, where I have sensitive skin, the next day I get a little bit of gunky conjunctivitis, and it's purely allergy. So I clean my eyes, it's gone, and it doesn't come back. I'll take a couple of antihistamines and I'm good to go. So it's worth noting, if someone does the next day have a little bit of conjunctivitis, it might not be bacterial. Recommend they pop to the chemist. The chemist will probably advise some antihistamines, and you get your client to give them a little cleanse. And if they're fine, it will just be a slight allergy. If not, then they might have a slight infection. If they've got conjunctivitis or signs of conjunctivitis pre-doing the eyelash extensions, do not touch it. They need to go and get it sorted before they come back to you. Undergoing chemotherapy, radiotherapy, if they're undergoing any of these sort of treatments, their immune system is going to be low. It's highly likely that they are going to react and they're going to have an allergic reaction. If they have had any recent eye operations, obviously generally you would want a note from their doctor, but you want to generally wait for 6 months. And then trichotillomania. I mean, I talked about this briefly earlier. Trichotillomania, if you don't know, is where you pick out your eyelashes. So for me, I'm a real picker. I pick my nails, I pick my eyelashes, but I don't pick my eyelashes when I don't have eyelash extensions on. However, when I do have eyelash extensions on, I pick. So I've had 2 clients that have had trichotillomania, and one, they've gone each way. One of them, I did her eyelash extensions and she loved them so much she never picked again. And the health of her eyelashes was amazing. So she was so grateful. However, I had someone else that had trichotillomania. I lashed them and it made it so much worse. So she actually caused more damage to her eyelash extension. So she was not a good candidate, as an example. So that's just an example of a few restrictive and preventative contraindications. Cross-contamination. It is imperative that your workspace, your equipment, and you as the technician are clean and hygienic at all times. Any disposables, get rid of. Under iPads, once they've been used, get rid of. Change your couch roll between every client. Make sure if you're brushing your client's lashes with a mascara wand, you give your client that mascara wand. You do not want to be putting it down. They've potentially got the start of an infection. You don't realize, and you use that same brush on your next client and give them something. So just be so clean and clinical in your salon. And then we've discussed contraindications and you've got contra-actions. So a contra-action is something that may occur either during or after the treatment. So a bit of sensitivity, a bit of redness, and allergic reaction. If a client does have an allergic reaction after treatment, I would be recommending they pop to the chemist to potentially get some antihistamines. We are not medically trained to recommend antihistamines and we can be held liable if we do so. So please do not recommend medication. If a client needs antihistamines, recommend that they pop to the chemist. I mean, they're probably going to pop to their drawer, but we need to be giving them the correct advice. Erythema, redness of the eyes. As the adhesive is drawn to the moisture of the eyes, sometimes it's drawn to the inside of the eye, kind of under here, which can expand the blood vessels and give clients, it's actually technically called a chemical burn, but obviously we don't want to say that to clients, but it's just a slight sensitivity. It will go down within 24 hours. However, if that does happen to a client, sometimes clients' eyes sit slightly open when they're lashing or they are just super sensitive. Most of the time you'll notice as the eyelash technician and you will just say to them that you've got a little bit of redness under the eyes. It's completely normal. They're slightly sensitive. It'll go down within 24 hours. If you don't tell them it's going to go down within 24 hours, you don't tell them that they've got redness and they go home and see it, they're going to be doing this, looking at their eyes thinking, oh my God, what's happened? Telling their friends, telling their family, do not go to J. Jones. Look what's happened to my eyes. Whereas a little bit of communication and education goes a long way in this industry. Okay. Next, we're moving on to pre-made fans, including eyelash extensions. So I'm going to explain to you exactly what eyelash extensions are.